March 12, 1944. A bitter wind whipped across the rolling hills of rural Alabama. German soldiers, weary, frostbitten, and still trembling from the shock of capture in the European theater, were herded from a small convoy of trucks into the gates of Camp Aliceville. The scent of freshly cut brass and wood smoke mingled with the metallic tang of the POW compound, a stark contrast to the mud-soaked fields and rubble of their homeland. You can almost feel the apprehension coiling in their chests as they shuffled forward, each man clutching a thin blanket, their boots worn through, their faces etched with the fatigue of months of combat. Corporal Friedrich Meyer, a 24-year-old from Hanover, shielded his eyes against the low afternoon sun. His stomach churned, not with hunger, but with disbelief. Beyond the barbed wire, rows of red brick buildings glinted with a sort of sterile precision, windows spotless, chimneys puffing orderly plumes of smoke. A group of American medics, crisp in white coats and pressed uniforms, moved with calm purpose. Their voices, steady and clear, carried instructions to the newly arrived prisoners in careful German. Meyer could not help but notice the absurdity. These men were not barking orders or brandishing rifles. They were guiding, organizing, helping. The prisoners were ushered into the medical compound first. Inside, the smell of antiseptic was sharp, almost intoxicating to men who had grown accustomed to the stench of overcrowded field hospitals and makeshift barracks in Germany. Rows of gleaming beds lined the hall, each equipped with crisp white sheets and neatly folded blankets. Nurses moved silently from one patient to the next, adjusting 4 drips, checking bandages, and recording notes in leather-bound charts. Meyer's eyes widened as he caught sight of a young soldier with a shrapnel wound. The wound was cleaned, dressed, and treated with equipment that seemed more surgical theater than prison infirmary. "You have never seen anything like this," muttered Private Klaus Reinhardt under his breath, echoing the disbelief that ran through the group. In the Reich, Meyer knew hospitals overcrowded, with barely enough bandages, and food rationed to the point of starvation. Here, in the heart of enemy territory, it was as if they had stepped into another world, a world where care was abundant and suffering did not go unnoticed. The medics smiled gently at their bewildered guests. Sergeant Martha Donovan, her hair tucked under a starched cap, knelt beside a trembling prisoner, adjusting his blanket. "You will be taken care of," she said softly in accented German. "Just relax. We have what you need." Meyer's hands trembled as he lifted his coat sleeve. For the first time in months, he felt an odd mix of shame and relief. Shame for expecting cruelty, and relief that his body would not rot in neglect, as it might have back home if the war had carried on differently. Beyond the beds, small pharmacy glowed with order, rows of bottles, jars, and neatly labeled containers stretched from floor to ceiling. Every vial and tablet was meticulously catalogued, ready for immediate use. Meyer's gaze lingered on the glint of surgical instruments arranged on trays, polished until they reflected the overhead light. He could not comprehend the sheer abundance. There were enough resources here to treat hundreds of men simultaneously, a luxury inconceivable in the cramped, undersupplied hospitals of Germany. Outside, other POWs were being directed to bathing facilities. Clean running water, soap, towels, items Meyer had not touched in months, waited for them. For many, it was the first real bath since leaving home, and the relief was almost overwhelming. The wind, biting yet less cruel here, carried the sounds of laughter and hushed conversations. The prisoners began to whisper among themselves, comparing their expectations to this reality. Every detail, from the orderly lines of beds to the calm efficiency of the medics, conspired to shatter the mental image they had carried of American captivity, harsh, punitive, and austere. Meyer's thoughts wandered briefly to the young men he had fought alongside in France, some of whom had succumbed to minor injuries because German field hospitals could not keep up with demand. The contrast was painful. Here, even the most minor wound would be treated with care and diligence. Here, every man had value, not just as a soldier, but as a human being. And for the first time since capture, Meyer felt a glimmer of hope, even if it was tangled with the disbelief that such mercy could exist in enemy hands. As night fell over Camp Aliceville, lanterns cast a warm glow across the compound. The prisoners settled into their neatly made beds, listening to the distant hum of activity and the occasional bark of a guard dog. Meyer lay back, staring at the ceiling, still trying to reconcile the dissonance of his experience, captured, defeated, yet cared for beyond anything he had imagined. Outside, the stars shimmered above the barbed wire fences, indifferent to human conflict, as if silently mocking the assumptions Meyer had brought with him from the front lines. March 13, 1944. The morning air was crisp, and a light frost coated the ground of Camp Aliceville. Meyer swung his legs over the side of the bed, shivering slightly as he adjusted the thin blanket around his shoulders. Around him the prisoners stirred, each man grappling with the surreal normalcy of the camp. Unlike the grim routine of German barracks, there was order without oppression, efficiency without brutality. The medical staff moved through the compound like clockwork, their presence both soothing and unnerving. Friedrich followed a line of men toward the mess hall, noticing the subtle ways the camp emphasized hygiene and health. Between the rows of beds, small stations were set up to administer medications and check vital signs. Each prisoner passed through, answering questions about pain, infection, or fatigue. Nurse Donovan, her brow furrowed in concentration, guided the men through the routine with calm authority. "Do not worry," she said to a young Bavarian soldier, inspecting a minor laceration. "We are thorough here. Everything gets attention." The efficiency of the operation left Meyer awestruck. Back home, such injuries might have gone untreated for days, or worse, been ignored entirely. After the routine checkup, Friedrich noticed the careful attention given to diet and nutrition. Mess halls were bright, orderly, and warm, a stark contrast to the cold, overcrowded dining halls of Germany. Steel trays were lined with fresh vegetables, bread, and soup, while a steady supply of milk and protein ensured the prisoners received more than just bare sustenance. The men whispered among themselves, amazed that enemies would provide such care, and even more stunned that the food was plentiful, varied, and nutritious. One soldier, Heinrich Bauer, muttered incredulously, "It is like they want us to live, not suffer." The words hung in the air, a mixture of disbelief and grudging gratitude. Later in the day, Meyer was escorted to a treatment room for a more thorough examination of his lingering frostbite and minor abrasions. Thomas Sinclair, an experienced army physician, greeted him with a firm handshake. "We will make sure you recover fully," Sinclair said, in carefully pronounced German. The doctor's hands were steady and practiced as he inspected Meyer's feet, wrapping each toe with fresh bandages and applying salve to aid circulation. The warmth of the room, the antiseptic scent, and the methodical process were all alien to Meyer. He had never been treated with such care or patience, especially by those considered the enemy. As the days passed, Meyer and the other prisoners began to notice the meticulous record-keeping that governed medical attention. Each wound, complaint, and procedure was logged in detailed charts. Names, dates, and treatments were recorded for reference, ensuring continuity and accountability. The German soldiers marveled at the contrast with their own experiences. In the Reich, paperwork was minimal, supplies were scarce, and the sick often waited hours or days before being seen. Here, Every minor injury was addressed promptly, and the medical staff seemed genuinely concerned with recovery rather than mere containment. The routine extended beyond medical treatment. Daily inspections, physical therapy sessions, and scheduled rest periods created a rhythm that balanced recuperation with orderly life. Maya watched as other prisoners, some barely able to walk, engaged in light exercises under the watchful eyes of medics. The goal was recovery, not punishment. He could hardly reconcile this with his expectations. He had anticipated humiliation and neglect, but instead found a system designed to heal, to restore, and to maintain dignity. Even recreational activities reinforced the camp's emphasis on health and morale. Sports fields, music rooms, and reading areas allowed prisoners to exercise both body and mind. Friedrich observed groups playing soccer on the frosty ground, their laughter echoing across the compound. Medical personnel monitored these activities closely, ensuring no one overexerted themselves, that injuries were treated immediately, and that spirits remained high. The Germans began to realize that this care extended beyond mere physical health. It was an investment in the mental and emotional stability of every prisoner. By evening, as Maya returned to his quarters, he felt a mix of fatigue and astonishment. The camp was transforming his perception of captivity, replacing fear and mistrust with awe and quiet appreciation. He caught himself thinking of the nurses and medics as something more than enemy soldiers. They were caretakers, dedicated to preserving life even in a time defined by destruction. March 15th, 1944. The mid-morning sun filtered through the frost-laced windows of the medical wing, casting long shadows across the polished floors. Maya moved cautiously, still adjusting to the rhythm of life inside the camp. Today he was scheduled for a routine dental check, a minor procedure, yet one that filled him with both curiosity and disbelief. Dental care in wartime Germany had been minimal, often postponed until it became unbearable. The thought that a dentist in enemy territory would treat him with precision and care seemed almost absurd. Lieutenant Karl Weber, a fellow prisoner, whispered as they waited their turn, "You think they will just pull a tooth without yelling at us or something?" Maya shook his head. "I do not know. It feels too normal." The door opened, and a young American dental officer, Lieutenant Margaret Whitman, greeted them warmly. She spoke in measured German, explaining each step before touching a single instrument. Her hands, gloved and steady, worked quickly but gently, cleaning, inspecting, and adjusting fillings where needed. The soldiers exchanged astonished glances. The meticulousness and attentiveness were far beyond anything they had expected. Outside the dental room, nurses moved between patients, checking charts and dispensing medication. Their eyes held a warmth that contrasted sharply with the cold suspicion of guards back in Europe. Private Reinhardt, still skeptical, finally whispered, It is like they actually care about us, not just control us." Maya could only nod, feeling an unusual sense of vulnerability, but also an emerging trust. This was an enemy that preserved life rather than exploiting or neglecting it. The medical wing was not limited to treatment rooms. Rehabilitation areas were filled with patients learning to walk again after shrapnel injuries, practicing exercises under the supervision of trained physiotherapists. One German soldier, missing part of a calf muscle, struggled along parallel bars. Nurse Donovan, patient and encouraging, adjusted his posture and offered words of guidance. Maya watched quietly, understanding the profound difference. Here, recovery was a science, a priority, and a promise, not a privilege reserved for a few lucky men. Even the smallest details conveyed thoughtfulness. Clean towels were always available, bandages were neatly folded and sterile, Even the simple act of handing a prisoner a cup of warm broth was performed with care. Maya began keeping track, almost unconsciously, of the many small acts of humanity. The medics did not just heal wounds, they acknowledged the prisoner as a person, not merely a number. And in doing so, they challenged every preconception he had carried since capture. That evening, Maya found himself in the recreation hall, where a group of medics had set up a small concert for the prisoners. Music filled the air, piano notes dancing across the polished wood floors, a violin echoing the melancholy of longing for home. Soldiers watched quietly, some humming along, some simply staring, absorbed in disbelief. For Maya, it was surreal, captured by the enemy, yet offered comfort and culture instead of punishment. The contrast with German wartime hospitals was stark. There, even the simplest acts of care had been interrupted by shortages, bureaucracy, and exhaustion. Here, every gesture was deliberate, precise, and intentional. As the night deepened, Eric returned to his quarters, replaying the day's events in his mind. He thought of Lieutenant Whitman's careful hands, Nurse Donovan's patient guidance, of the way the medics smiled even when dealing with dozens of new arrivals. The concept was alien. In the Reich, wounded soldiers were often treated with indifference. Minor injuries might fester, infections ignored, pain endured in silence. Here, in the heart of enemy territory, the same men who could have been cruel were instead compassionate, professional, and ridiculous. By the time the lights dimmed across the camp, a quiet murmur of conversation had spread among the prisoners. Words like impossible and luxury were whispered in disbelief. Maya, staring at the ceiling of his orderly bed, could feel a subtle shift within himself. The war had not only captured his body, but challenged the very assumptions he carried about honor, duty, and the enemy. Here, amidst the antiseptic scent and disciplined calm of Camp Aliceville, Friedrich Maya began to understand that humanity could exist even in times of conflict, even between sworn enemies. March 17, 1944. A soft drizzle fell over the compound, glistening on the wire fences and dampening the red brick walls of the medical building. Maya pulled his coat tighter around his shoulders as he followed the line of prisoners to the infirmary. Today's focus was on preventive care, something utterly foreign to him. The Americans were not only treating injuries, but actively monitoring for signs of infection, malnutrition, and even psychological strain. Every man had his blood pressure checked, weight measured, and health notes updated in meticulous detail. Friedrich glanced around the room. Rows of patients reclined on clean beds, bandages replaced, wounds cleaned, and 4 drips regulated with precise timing. Medics moved silently between them, speaking softly, offering reassurance. He caught sight of Sergeant Donovan kneeling beside a trembling prisoner, adjusting the temperature of the water for a bath, and explaining the importance of hygiene for healing. Maya's mind raced. In Germany, cleanliness often depended on luck and available supplies. Here, it was a strict protocol, an extension of care itself. Later, he was called for a routine chest X-ray. The procedure, which would have been hurried and chaotic in a German hospital, was conducted with remarkable efficiency. Lieutenant Sinclair guided him through the process, carefully explaining each step. "Keep still," he instructed, placing the protective apron over Friedrich. The machine whirred softly, casting a pale light across the room. The image, developed immediately, was reviewed on a bright light box. Sinclair pointed out minor anomalies, explaining the treatment plan in a calm, methodical voice. The level of detail stunned Maya. This was not just treatment. It was education, empowerment, and reassurance all at once. During free moments, prisoners observed the medic's attentiveness to both minor and serious ailments. One soldier, previously suffering from a lingering knee injury, was now participating in light exercises under careful supervision. Another, recovering from trench foot, was given a regimen of foot baths and massage therapy that gradually restored circulation. Friedrich could hardly believe the resources and time dedicated to what he considered minor issues. In Germany, minor wounds often went untreated until they became severe. Here, prevention and care were paramount. Meyer began to notice a pattern. Every act of care carried intention, from the meticulous folding of bandages to the exact timing of medication. Even in the kitchen, staff ensured nutritional meals reached every patient, taking into account dietary needs and health conditions. Prisoners whispered among themselves, their disbelief growing. "They are treating us like human beings," muttered Private Bauer. The statement, simple as it was, carried the weight of weeks of starvation, pain, and distrust. Outside the medical wing, the cultural shock continued. Americans, even those tasked with supervision rather than direct care, treated prisoners with courtesy and respect. Guards spoke politely, assisted with clothing, and sometimes offered small comforts, a blanket, a hot drink, or a kind word. Friedrich's disbelief deepened. The enemy was not only skilled in medicine, but committed to preserving dignity, even in captivity. The moral contrast between this experience and the neglect or indifference he had seen in German hospitals left a profound impression. As evening descended, Meyer sat quietly on a bench near the recreation yard, watching snowflakes begin to fall. The medical wing glowed warmly behind him, lights illuminating the orderly beds and the calm faces of nurses and medics. For the first time since his capture, he considered the possibility that being a prisoner did not necessarily mean suffering or dehumanization. He reflected on his preconceptions, realizing that what he had imagined as inevitable cruelty was replaced here by competence, compassion, and attention to detail that bordered on meticulous artistry. Even among his fellow prisoners, subtle shift was evident. Fear had given way to cautious appreciation, skepticism to awe. Soldiers spoke softly of the care they had received, the respect shown by the medics, and the stark contrast with German field hospitals. Meyer's thoughts returned again to Lieutenant Whitman and Sergeant Donovan, their calm efficiency and gentle authority, emblematic of a broader truth. In this camp, enemy hands could heal, not harm, preserve life, not merely detain it. As the night deepened, Friedrich lay in his bed once more, listening to the soft murmur of voices and the occasional clatter from the mess hall. Outside, the wind whispered across the fences, a reminder of the world beyond the camp. Yet here inside, a quiet humanity prevailed. Meyer drifted towards sleep, mind racing with disbelief, wonder, and a budding respect for the meticulous care that had become his daily reality, a care that shattered every expectation of captivity he had carried across the Atlantic. March 20th, 1944. The morning sun reflected off the frost-lined windows of the camp hospital, catching the gleam of freshly polished surgical instruments. Meyer followed the line of prisoners into the medical wing, noting the way each man moved with cautious expectation, some limping, others still pale from untreated injuries. In one corner, Private Reinhardt was sitting upright for the first time in days, his bandaged arm supported by a sling, and physiotherapy exercises monitored closely by a kind-eyed nurse. The pride and relief in his eyes were unmistakable, a testament to the transformative care he had received. Meyer's own journey of recovery continued in small, precise steps. Lieutenant Sinclair reviewed his charts daily, ensuring every minor abrasion and frostbite blister was treated promptly. Today, Sinclair demonstrated how to wrap the bandages to protect the wound from infection and reduce swelling. Attention to detail now prevents complications later, the doctor said, his tone matter-of-fact yet reassuring. Friedrich realized he had never experienced such careful attention in a German field hospital, where soldiers were often left to their own devices once initial treatment was applied. Elsewhere, the medics orchestrated a routine that blended recovery with education. Prisoners were shown how to clean and care for wounds themselves, how to maintain hygiene, and how to follow instructions for physical therapy exercises. Maya watched as Private Bauer carefully followed each step, encouraged by the patient guidance of Sergeant Donovan. The process was methodical and respectful. The American staff treated them not as enemies, but as patients entrusted to their expertise. The prisoner's disbelief was giving way to genuine gratitude, a sensation that many had not felt since leaving home. Even the smallest gestures carried immense weight. Nurse Whitman handed a warm cup of tea to a trembling soldier, explaining its role in soothing chills and aiding recovery. Another medic adjusted the mattress for a man with back pain, ensuring comfort while he rested. These seemingly minor acts of consideration left a deep impression. Friedrich realized that in Germany, such attentiveness was reserved for officers or those deemed most valuable. Here, every man mattered equally, and every wound, no matter how small, was treated with dignity. Maya began to hear personal stories around him. One soldier recounted a foot injury that, untreated, might have led to permanent disability. Another spoke of malnourishment and exhaustion that, in a German hospital, would have worsened in isolation. Yet here, after days of attentive care, they were regaining strength and mobility. The sense of human decency, professional competence, and compassionate care was overwhelming. For many, it was a revelation. The enemy could show humanity, and it was more effective than fear or coercion. The psychological impact was as profound as the physical. Men who had entered the camp anxious, suspicious, and tense were beginning to relax. Laughter returned to the mess halls, quiet camaraderie resumed in the recreation yard, and conversations shifted from despair to hope. Maya noticed that even minor progress, bandages replaced, stitches healed, mobility regained, was celebrated quietly among the prisoners. They began to look at the medics not merely as caretakers, but as allies in their survival, despite the vast gulf of language, nationality, and circumstance. One afternoon, Maya found himself speaking with Sergeant Donovan in the courtyard, a rare moment of one-on-one conversation. She asked about his injuries, then about his family back in Hanover. He hesitated, unsure how much to reveal to an enemy, yet found her calm, empathetic demeanor disarming. "We are here to help," she said simply. "Everything else we leave behind. You focus on getting better." Maya's chest tightened. He had never encountered such unguarded compassion from those considered enemies. It was disarming, and in some ways, humiliating to realize how little he had expected from those who captured him. As the evening approached, the medics began preparing for the next day, reviewing charts, setting up beds, and checking supplies. Friedrich observed the precision, the care, the way even the smallest detail was considered. He realized that this attention, combined with the plentiful resources and the calm authority of the medical staff, was the very reason the camp had maintained high morale and minimal illness. It was a system designed not to punish, but to restore, an alien concept to men hardened by European battlefields and field hospitals plagued by scarcity. Maya lay in bed that night, reflecting on the extraordinary care he had received. The sterile scent of antiseptic, the warmth of clean sheets, the patience and skill of the medics, all had combined to create an environment where even enemies could recover fully, without fear or neglect. In the quiet of the camp, amidst the soft glow of lanterns and the distant murmur of fellow prisoners, Friedrich understood a truth that would stay with him long after the war, that compassion, skill, and humanity could thrive even amid conflict, and that being captured did not necessarily mean suffering. It could unexpectedly mean care. March 25th, 1944. A gentle snow had settled over Camp Aliceville overnight, dusting the rooftops and lining the pathways in crisp white. Friedrich Meyer walked slowly through the compound, his boots crunching in the powdery snow. Around him the camp hummed with quiet activity. Medics moving between buildings, prisoners engaged in rehabilitation exercises, and guards carrying out their duties with professional detachment. Everything was orderly, efficient, and, most disconcertingly, humane. He paused outside the medical wing, watching Sergeant Donovan assist a young Bavarian soldier with his physiotherapy exercises. The way she corrected his posture, encouraged him to stretch, and monitored his movements was precise, almost scientific. Yet beneath the discipline was a quiet compassion, a genuine investment in the well-being of those under her care. Meyer reflected on the stark contrast to the hospitals back home, overcrowded, chaotic, and often indifferent to suffering. Here, the American medics treated even minor injuries with diligence, ensuring every man had the best chance to recover. Over the following days, Friedrich and his fellow prisoners began to share their observations more openly. Stories circulated of men whose lives had been saved by prompt surgical attention, of minor infections avoided through careful monitoring, and of nutrition and hygiene standards that had kept illness at bay. For many, the realization was almost overwhelming. The enemy, whom they had been trained to fear and despise, could provide a level of care they had never known in their own country. Private Reinhardt whispered to Meyer one evening, "It is almost like we have landed in a different world. How can they treat us like this?" Meyer could only shake his head in disbelief. He recalled the first day of arrival, the polished floors, the gleaming surgical instruments, the gentle hands of Lieutenant Whitman and Sergeant Donovan. Every small act of kindness had been consistent, deliberate, and unwavering. The prisoners began to recognize that this care was not a one-time act of charity, but had a fundamental principle guiding life within the camp. It was as though the Americans had built an entire world in miniature, one where human dignity and physical well-being were paramount. In quiet moments, Friedrich allowed himself to imagine what it would have been like if such resources had been available back home. Soldiers he had known, some who had suffered minor wounds that became fatal due to neglect, might have survived, thriving in a system built for recovery rather than minimal maintenance. The contrast struck him deeply, leaving a lingering mix of gratitude, awe, and quiet sorrow for those who had not been so fortunate. Even simple interactions reinforced the lesson. A nurse passing by with a tray of warm soup would smile, pause to offer encouragement, and ask about a prisoner's comfort level. Medic adjusting a bandage would take time to explain why each step mattered, engaging the soldier in the process rather than merely performing it. These were not grand gestures, but they accumulated into a profound experience, reshaping how prisoners like Meyer viewed both the enemy and the possibilities of humane treatment in wartime. By late March, the transformation was evident. Soldiers moved more confidently, spirits were lifted, and injuries healed faster than anyone had anticipated. Meyer could see it in the way men carried themselves during morning roll calls, how they approached their rehabilitation exercises, and the subtle camaraderie that had developed between prisoners and medics. The experience was reshaping their expectations, not only of captivity, but of human behavior itself. As night fell and the camp settled into quiet routine, Friedrich Meyer lay in bed, reflecting on the extraordinary weeks he had spent at Camp Aliceville. The precision of care, the abundance of resources, and the unwavering compassion had left an indelible mark. He understood now that shock and disbelief were natural responses to such unexpected treatment. Yet he also realized that his experiences here would remain with him long after the war, a testament to the idea that even in the midst of conflict, humanity could endure, and that mercy and skill could triumph over fear and neglect. For Meyer and his fellow prisoners, the memory of this care would become a story in itself, a story of shock, revelation, and the enduring power of empathy in the darkest of times. April 5th, 1944. The first hints of spring had begun to thaw the frost across Camp Aliceville, revealing the neatly kept lawns and orderly paths that had impressed Friedrich Meyer from the moment he arrived. Rumors of an upcoming transfer to another facility stirred the prisoners, and with it, a mix of excitement, anxiety, and an unexpected sense of gratitude. For Meyer, leaving the camp meant stepping back into uncertainty. But he carried with him the indelible lessons of care, efficiency, and unexpected humanity. The morning roll call was brisk, crisp as always, yet there was an unspoken pause among the prisoners as medics and nurses passed by, offering nods, smiles, and gentle words of farewell. Lieutenant Whitman, knelt briefly by Friedrich, adjusting his coat and speaking softly. "Take care of yourself. Remember what you have learned here, about recovery, about patience, about care." Meyer nodded, a lump forming in his throat. He had never imagined that an enemy could offer not only survival but dignity, and that such treatment could leave a lasting impression stronger than fear or hate. As the prisoners were loaded onto trucks for transfer, Meyer cast one last glance at the red brick buildings, the orderly rows of beds, and the medics moving with quiet authority. Each image was seared into memory. Sergeant Donovan guiding a limping soldier along the parallel bars, Lieutenant Sinclair reviewing charts with painstaking care, the nurse's gentle hands tending to minor injuries, as if each man's life was a treasure to be preserved. For the first time in months, Friedrich felt a profound respect, not for weapons or strategy, but for the simple, radical act of caring. In the weeks and months that followed, stories of Camp Aliceville spread among German prisoners and soldiers alike. Men spoke in hushed tones about the medical wing, where wounds healed quickly, where hygiene was enforced without cruelty, and where medics treated prisoners as human beings rather than enemies. These recollections challenged ingrained notions of endemic cruelty and reshaped perceptions of war itself. Meyer found himself recounting the experience to fellow prisoners during marches, sharing the astonishment and the lessons of compassion and competence. Even years later, Friedrich would reflect on those weeks as a turning point. The shock of encountering American medical care, clean, well-equipped, and staffed by professionals committed to both healing and humanity, stayed with him long after the war ended. It influenced his understanding of duty, responsibility, and the capacity for kindness even amidst conflict. Where he had expected neglect, he found skill. Where he had anticipated cruelty, he encountered mercy. The juxtaposition of expectation and reality had left him both humbled and enlightened. For the American medics, the work was routine, a duty fulfilled with precision, efficiency, and professionalism. Yet for the prisoners, every bandage, every careful examination, every warm word became an extraordinary act, unforgettable in its impact. Meyer carried these memories like a ledger of human decency, proof that even in the harshest circumstances, compassion could thrive, and that shock and disbelief were the natural responses to witnessing it for the first time. As the convoy rumbled away from Camp Aliceville, Friedrich Meyer looked back at the orderly compound, the glinting windows, and the soft plumes of smoke curling from the chimneys. He knew he would never forget the shock of seeing care where he expected neglect, humanity where he expected hostility. It was a lesson in the paradoxes of war and the enduring power of human compassion, a story he would carry for the rest of his life.